Good morning and welcome to this edition of the YouTube videos on Pain Free Partha channel. Today we are going to discuss on Tramadol. Before anything else, I wish to put a big salute to the legendary teacher of 2 centuries, Professor Ravi Shankar, who is currently the director of Sea Dreams of Mahatma Gandhi Medical College and Research Institute, Sri Balaji Vidyapeeth University, Pondicherry, India. So what is this Tramadol? It's a synthetic codeine analog. We know codeine is a natural analgesic, cum cough suppressant. It's a synthetic codeine analog. So it was first developed in Germany in the 1970s, and various formulations like drops, extended release, IM, IV, rectal suppository have been launched since 100 countries in these 40 to 50 years. Now there's a small difference between tramadol and codeine. So what does it do? Tramadol is a centrally acting analgesic structurally related to codeine and morphine, consists of two enantiomers which acts through different mechanisms. We have already told isomerism and anesthesia, enantiomers, stereomers, all structural isomerisms in a different YouTube video of Pain Free Partha. Now, this tramadol and O-desmethyl tramadol mu are agonists of the mu receptors, and this plus minus tramadol also acts on the serotonin uptake, and another enantiomer can act on the norepinephrine reuptake. So these are all the mechanisms. Number one is mu receptor. Number two is inhibition of serotonin reuptake. Number three is inhibition of norepinephrine reuptake. So serotonin, norepinephrine will be more. Opioid receptor mu action is there. These are the three mechanisms of centrally mediated analgesic property of tramadol. There are a lot of formulations: oral, rectal, IM, IV, epidural, intrathecal blocks, etc. Now we will go to what are the indications of tramadol. When should we use this? It can be used in acute pain and chronic pain. Okay. In the acute pain, it may be in postoperative pain, sometimes in labor pain, it may be in trauma or operation. Chronic pain is malignant pain and non-malignant pain. All these things are indications of tramadol. There are few other indications which will come later. There are off-label uses. It can use it for shivering, can use it for premature ejaculation, restless leg syndromes, additives, local anesthetic drug, as a local anesthetic drug. These are all the other off-label uses of tramadol. Now, what dosage we have used? I have used personally, I have used 100 milligram BD, I have used rectal 100 milligram BD, I have used 50 to 75 milligrams every 4 to 5 hours, I have used 100 milligram IM TDS, I have epidural 50, intrathecal 10. So, if you want to give in kidney disease, yes, half the dose at low DFR. Liver impairment, there are no studies. After oral administration, tramadol is actually present as tramadol hydrochloride, is rapidly and completely absorbed, up to 6 hours action. Sustained release may go up to 12 hours. So this is about oral tramadol. Tramadol is rapidly distributed in the body. Plasma protein is 20%. It is metabolized to O-desmethyl and N-desmethyl by conjugation reactions. Formation of glucuronides and sulfates excreted via the kidneys to have a half-life of 6 hours. So there are some polymorphism, genetic polymorphism, significant variable in the efficiency among individuals. Why tramadol? For example, one of my relatives, which I gave tramadol 50 milligram tablet, he did not get up after the next day after 11 a.m. also. So there may be a significant variability in the efficiency because of genetic polymorphism. So this study is out from our institute. Now we go to Tramadol-Ondansetron Interactions. We always give tramadol and then give, we say, oh, whatever it is, ondansetron. Nausea is a predominant or prominent adverse effects with tramadol. So we always use ondansetron. But the problem is because they both act here in serotonins. So that may be effective. But what the problem is, sometimes pro-serotonergic medications can result in hyperserotonergic develops. This also can be there after tramadol. I will come with tramadol, serotonin, the tramadol-ondansetron interactions again. What I want to tell is ondansetron is an ideal drug for tramadol-induced vomiting because tramadol-induced vomiting is partially acting through serotonin. This is what I want. So while your ondansetron is direct serotonin antagonist. So serotonin, that is why there is a possibility of serotonin syndromes. Analgesia, there is also a descending modulation system. The other actions are euphoria, sedation. Sometimes it may cause constipation, nausea, sweating, pruritus. So it does not cause much of histamine release. It does not much got of heart rate, LV function, or cardiac index. It may cause some respiratory depression. It may cause decreased responsiveness to CO2. This is all minimal. So there is no effect on heart rate unless morphine. There is no effect on histamine release unlike morphine. Ortho hypertension is observed, but respiratory depression is not as much. So these are all the clinical significant differences of tramadol over morphine. Tramadol depresses the cough reflex by a direct effect on the cough center. That is why sometimes, this cough consistently cough with this muscular pain. Sometimes we can use this pain and cough. Cause meiosis in total darkness. So these are generalized seizures may occur within 24 hours after administration. That is why seizure prone patients avoid tramadol. If the patient is seizure prone, for example, the patient is eclampsia, don't give. Already the patient is a known seizure patient coming for hernia. He is on eptoin and some carbamazepine. Don't give tramadol. The fundamental message which is needed as a basic thing. Yes, we can give tramadol, but beware. Tramadol has been reported to have distinct SNRI serotonin reuptake associated with withdrawal symptoms. So it is also an addiction, some sort. So withdrawal symptoms, desirable euphoric stimulant and relaxing. So that is why it has got the abuse potential. Now shivering. Tramadol is synthetic opioid agonist, prevents shivering by inhibition of this and activating the descending. Usually I give only 0.5 milligram per kg, some 20 milligram, 25 milligram of tramadol IV. Sometimes even 10 milligram is useful. But we may need to repeat after 20 to 30 minutes. That is one of the disadvantages of IV tramadol on shivering. Gastrointestinal tract and smooth muscles, decreased tone of gastric, colonic, and biliary muscles. Severe hypotension where there is a compromise or where there is an already vasodilated drug going on or there is a reduced blood volume. There only it may cause hypotension. Routinely in healthy patients, it is unlikely to produce severe clinically significant BP fall. Very important thing, hyponatremia. When you have a predetermining factor like elderly patients, hip fracture, patient is in pain, tramadol is given. After some time, 1 or 2 hours, patient becomes disoriented. Also think of hyponatremia rather than your tramadol euphoria. So tramadol also can hyponatremia in such vulnerable cases. Yes, we have already told withdrawal symptoms can happen like diarrhea, goose flesh, loss of appetite, nausea, so many things, shivering, stomach cramps, all classical of withdrawal symptoms. In acute pain relief, we will go to the indications now. It is equivalent to morphine, 1.5 milligrams to moderate pain, may be better with less side effects. Valdecoxib equal to blocks on pediatrics. There are a lot of studies, but valdecoxib is now out. Tramadol is about acute pain relief, we have told. Tramadol is used to, what we have used is around tramadol 100 milligrams, almost equivalent to 75 milligram of pethidine with our clinical experience. Weaning of patients who shows recovery should be potentially extubated. not in head injuries. Sublingual ketorolac and sublingual tramadol. Yes, both are okay in children. Tramadol is effective is as Pethrin 75 but has a superior safety profile. We have used and we are using labor pain tramadol like routine. Tramadol 100 milligram IM I prefer. Some people prefer IV. This is about acute pain relief. We can use it for perioperative pain relief. We can use it for trauma pain relief. We can use it for labor pain relief. These are the three things about acute pain relief in trauma. But beware head injuries. Beware hip injuries with hyponatremia. These are the two things which we should be keeping in mind before using tramadol for acute pain relief. Epidural 50 milligram adequate pain relief, 100 milligram with some vomiting. 2 milligram per kg is slightly better, but vomiting and nausea is more. So preferable to give 50 milligrams of epidural tramadol. This is our article, intrathecal tramadol in the management, not more than 10 milligrams. It is effective, but if you use 25 milligrams spinal, yes, definitely nausea and vomiting is predominant. So I have used 50, 25, 10, everything. But what my thing is, use 10 milligram, that is enough. In peripheral blocks, use 100 milligram as an adjuvant. They say shortening of sensory block, motor block, and slight prolongation of sensory analgesia. 100 milligram along with your bupivacaine. As a local anesthetic alone, even as local anesthetic agent in dentistry, this is what I want to tell. Sometimes you have a problem with local anesthetic. Your volume is high, you are close to the vessel, then you add 3 ml bupivacaine and 3 ml tramadol. So that is effective as a local anesthetic, especially when you combine. There's another point which I want to tell. When the dental people are close to vascular channels and there is a possibility of loss. So this is diclofenac. So ointment is there, tramadol ointment. You can see tramadol ointment. Topical 5% tramadol with its local anesthetic and also is being used in the management of tonsillectomy. Suppository is very efficacious and we have used a lot of diclofenac suppositories, 100 milligrams, hundreds and thousands of cases, very less side effects and efficacy is good. Oral drops for adults and children. Yes, 20 drops per dose for adult and less than 12, 10 drops. Yes, 12 drops is available. This is about acute pain relief and other indications. Osteoarthritis, low backache, migraine, neuropathy, malignancy. 50 milligram in the night, tolerance is S. Malignancy, weak opioids, step-ladder pattern of malignant pain, it is available. Osteoarthritis, so many combinations with paracetamol and 37.5 milligrams of tramadol are available in the market. You can use up to 50 milligrams in the night. Tramadol, there is one advantage which I want to tell. This tramadol, if you give IM or IV, if you use repeatedly the second time, the O-desmethyl tramadol is also an active ingredient. Okay, but if you go to pethidine, norpethidine is an inactive drug. It may cause fits also. Here, that is why if you go on giving repeated doses of tramadol, after the second or third dose, your dose desmethyl tramadol is going to rise. So that is going to cause better relief than pethidine. This is what we have found out and published. So intramuscular tramadol, 3 doses. After the third dose, it is better than third dose of pethidine if you want to give as an IM for routine surgeries. So tramadol hydrochloride, the chemistry is a synthetic analog of codeine. Mode of action is about mu, serotonergic, noradrenergic mechanisms. The dosage we have told is available as so many 100 milligrams suppositories, 100 milligram IV, IM, and subcutaneous also we can use, epidural we can use, and the routes spinal we can use, as an ointment we can use. So many things are there. What are the effects in the CNS? Analgesia, sedation, sometimes dizziness, ataxia. And in the CVS, hypotension is likely to occur only in patients where there is a volume compromise or where there is some other problems. In the respiration, not much of effect, even with epidural or intrathecal tramadol. Intrathecal or epidural tramadol, respiration, CVS is not a problem. But only problem is about nausea and vomiting if you have neuraxial tramadol. So that is what the problem of hyponatremia with hip fracture. All these things we should make in mind. If there is an interaction between tramadol and ondansetron, ondansetron is likely to be a better option of tramadol-induced vomiting, but that disadvantage is ondansetron will decrease the efficiency of tramadol. Tramadol, if you give, after ondansetron, if you give tramadol, you may need to give 10 to 15% extra because ondansetron will kill also the analgesic effect of tramadol. So this is what I want to tell in this tramadol. Thank you very much.